Hi, this is RJ Manasa from Fever FM Hyderabad, and today we are present here to create awareness about a very, very important issue, and that is stroke. You must be wondering why. Let me tell you why. Because it has become a global public health issue, and also increasingly it has become the reason for too many premature deaths and disability. You will be surprised because I was when I learned that one out of every four person has a chance of suffering from stroke. And listen to this is alarming. 1.8 million people in our country, they are suffering from this problem, stroke. So Bantana, we have to create some awareness regarding this. And today, to do just that, I have Dr. Dharav Kheradia from Lakeshore Hospital, Kochi with me. Welcome, Dr. Kheradia. How are you doing?
Thank you so much. I'm fine. I'm fine. How are you?
I'm doing good, sir. I'm doing good. And today, we are here to create awareness about a very, very important topic. So I want to start with what is brain stroke and how severe is this disease, sir?
Brain stroke is basically it's disease of blood vessel. It's not a disease of brain. We can say it's a
Right.
disease of blood vessel of the brain. So we can
Right.
broadly we can say it is two type. One type where you say the blockage is there in the blood vessel of the brain. The supply to the
Right.
brain is disrupted. So that will
Right.
cause ischemic stroke. The second variety of stroke is hemorrhagic stroke. Because of some reason, the bleeding happens inside the brain. The blood vessel bursts out. So that is
Right.
known as a hemorrhagic stroke. So we can divide stroke basically into two basic categories. One is ischemic stroke,
Right.
where you have blockage of blood vessel, like the heart, you see the heart attack. Similarly, we have brain attack. So that
Right.
is like 80% of stroke is ischemic stroke because of blockage of blood vessel, and
Right.
around 15 to 20% is because of the bleeding inside the brain. So these are the two basic broad classification of the stroke. So basically, it's disease of blood vessel of the brain.
Right. And it's super serious.
It's a serious disease, definitely. It will make you disabled. You will be bedridden. You may not
Right.
function normally. It is not painful disease, but it's a serious disease.
My God, my God. Yes, that's exactly why we are here, trying to create awareness about stroke on World Stroke Day with the Dr. Dharav Karadia, who's an interventional radiologist, consultant interventional radiologist from Lakeshore Hospital, Kochi. Now, moving on to the next question, Doctor. What are the symptoms of stroke, if you can tell us? And also, how do we recognize this, symptoms in someone?
As I told you, this stroke is not a painful condition. So,
Right,
like let me tell you, everything, our bodily movement, now you are walking, you are talking, you are speaking, everything is controlled by the brain. So
right,
when you have stroke, all those functions are affected. So, like patient will have or person will have facial weakness. So drooping of face will happen like this. One side it is deviated. Then you have weakness in the arm and the leg. So if suppose damages happen on the right side of the brain, your left side will be paralyzed. Person may not
huh,
able to lift the arm, he may not able to walk. Then the difficulty in the speech may happen. Person may not able to tell his name. He's not in a conscious state. So these are the common symptom of the stroke. So we remember by acronym like FAST. So FAST stand for F stand for facial weakness. A stands
right,
for arm weakness, arm or leg weakness. S stands
right,
for speech, and T for
right.
the child. So if you observe such kind of symptom, facial weakness, arm weakness, speech difficulty, so probably you are dealing with the stroke. And in such cases, you have to rush to the hospital in time. Other symptoms, maybe if bleeding happens, then patient may have severe headache. Sometimes patient may have imbalance while walking, difficulty in vision. These are the special type of stroke. But commonly we
Right,
see this paralysis, attack, and speech difficulty. So it is
right,
very important to identify such symptom because it is not a painful condition. So
right.
because reaching to a particular stroke hospital is very important. So it's most important to identify such kind of symptom.
Right, sir. Right. And can it be prevented? Are there any preventive measures for this, doctor?
Yeah. Stroke can be definitely prevented. No, for first of all, you should understand what are the risk factor. As I told you
Right,
earlier, it is not a disease of brain; it's disease of blood vessel. So basically,
right,
all those common risk factor which applies for the heart attack, same risk factors are applied here also. Like what are the common risk factor like high blood pressure, you have diabetes mellitus, you have high cholesterol, you are not exercising regularly, you have obesity,
Right.
smoking. So these are the common in general risk factor for the stroke. So it can cause blockage of blood vessel or the bleeding. So if you control all these risk factor, definitely stroke is preventable.
And how do we control that?
So like you have to regularly check up your blood pressure. No, if you are above 40, you should do regular checkup of blood pressure. If you have family history of diabetes, you should check your sugar regularly. You should check your weight in control. Cholesterol you can check, go into laboratory. So these are the basic checkup you have to do it.
Right, sir. And now moving on, doctor, what are the treatment options, we have for stroke?
So we'll discuss about ischemic stroke, which is common stroke, which is because
Right.
of clotting or blocking of the blood vessel.
Right.
So if person reaches to hospital in 4.5 hours from the onset, suppose you develop stroke at 12 o'clock and you reach
Right.
hospital by 4 o'clock. So you reach hospital by 4.5 hours. Then the first thing we do a CT scan just to rule out bleeding has not happened. And if bleeding is not there, means you are having blockage of blood vessel, means we have to open that blood vessel. So first we give injection, clot busting
Right.
injection is given, which is no IVTPA. Commonly we call it as
Right.
IVTPA. So that injection is
Right.
given to burst the clot inside the blood vessel. But if you are not reaching in 4 point, because this injection is effective only for 4.5 hours time, maximum
Oh,
effectiveness. So
okay.
if you are not reaching in 4.5 hours time, then we cannot give this injection. Then there are
Right.
certain other patients like who is having large clot. So this medicine is not effective for a large clot. So for large
Right.
clot, which is causing large blood vessel occlusion, we have to remove clot mechanically.
Right.
So we do this procedure known as mechanical thrombectomy. It is like angiographic procedure. It is done in the
Right.
cath lab, where we use a special device called stent retriever. We reach
Right.
all the way to the clot. We keep it there for some time and then we remove it. And
Right.
thereby we remove the clot and restore the blood flow. If you do such kind of treatment a timely manner, then the chance of recovery, like 2 out of 3 patients, will be independent at the end of 3 months. So procedure success rate is almost like 60-70%. If timely treatment is done, then
Right.
good chances of recovery are there. So these are the two basically with this injection and this mechanical thrombectomy.
Right. Right. Now, finally, why is there so much discussion about time? Like you said, time. When we talk about stroke, we talk about time so much, like you just mentioned. Why is that, doctor?
Basically, this brain is most vital organ of the body. It cannot survive without blood for 5 minutes. Blood,
Yeah.
oxygen, glucose. So, like researchers, the scientists have estimated that 1 minute of delay, if you delay treatment for 1 minute, then 19 lakhs
Yeah.
neuron brain cell will die. So
Okay.
that's why the timely treatment is so important, because we have to
Okay.
save the brain parenchyma as much as possible. This is possible
Right.
only if you reach hospital in time. If delay happens, then by the time the brain cell will die. So that's why time is most important. That's why
Right.
we are here to create awareness. So timely identification and reaching to the stroke ready hospital is most important to prevent long-term disability.
There is a myth that, people with high blood pressure should be very careful. Is that a myth or?
Be careful means the blood pressure should be under control. I
Ah,
mean,
okay.
definitely, because increased blood pressure will make you will have this stroke, you will have heart attack, you will have kidney
Right.
dysfunction. So you should definitely check your blood pressure regularly, and it should be under control.
Right, right, sir. Finally, there's a lot we didn't know. Thank you so much for all the clarification. But before we leave, we should at least leave a last message for our audience. If you can just give us a couple of lines about stroke, what message would you like to give our viewers?
So most important thing is identification of the stroke. You should remember the common symptom of the stroke. If you feel
Right,
like a person at risk, if you identify those person who is having stroke, and just don't go to some ordinary hospital. I mean, don't go to some small nursing center, because they don't have facilities there. You need to
Right.
go to hospital which is having all this facility like CT scan, IV thrombolysis, thrombectomy. Otherwise, you will waste your time. So identify in the time and go to the correct hospital is my message to prevent
Right.
this stroke, long-term disability. And be
Right.
healthy, do regular exercise, identify those risk factors so that you won't get a stroke. Prevention is better than the cure.
Of
That is my
course,
message.
of course. Oh, I couldn't have left with a better message. Prevention is better than the cure. But when you can't prevent it, if you're too late, be timely and get your checkups done and visit a good hospital. This is the message we are leaving our viewers with. But thank you so much for talking to us and shedding so much light on information that needs to be, discussed on World Stroke Day about stroke. Thank you so much, Dr. Dharav Kheradia. Thank you so much.
Thank you. My pleasure. Thank you.
That was Dr. Dharav Kheradia, consultant interventional radiologist from Lakeshore Hospital, Kochi. And like you just heard, we learned a lot about stroke. Health is of paramount importance. I think 2020 taught us, there is nothing more important than health. It can just turn the world upside down. So let's take care of our health, regular checkups, workouts, and, good diet. All of this is important. And also choose your hospital right. On World Stroke Day, please be careful. This is RJ Manasa from Fever FM Hyderabad signing off. Take care of your health. Stay safe.